Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and today I'm lucky enough to be stranded on a Caribbean island. It's beautiful, but we're exposed to the sun all day long. Also, when you're talking with the locals or venturing off resort, I'm hearing a lot of reggae and I'm seeing a lot of Bob Marley t-shirts. This is a prime example of someone who is famous, someone who is out and about and very vocal with his life, but unfortunately did pass due to a skin cancer. Skin cancers are quite common. 1 in 5 Americans are going to develop skin cancer. Skin cancer is going to come in places that are most exposed to the sun, like the scalp, the ears, the face, the backs of hands, into the legs, and even onto the feet. We tend to forget about things below our waist being exposed to the sun. For Bob Marley's case, it was unfortunately a melanoma. Melanoma happens between 5 and 15% of all melanomas do show up into the foot and ankle. So it is important to watch those areas. Speaking of that, what are we going to do to watch the areas? We're going to go through an alphabet for checking our skin. Our first letter is going to be A. So we're going to make sure that the lesion or the freckle, the mole, what we're looking at is symmetrical. We want to make sure that it is a nice even circle. It's not an oblong shape or something odd. B is going to stand for border. We want to make sure that that border is clearly defined and it's not like leaking into the skin around it. We want to make sure, again, it's regular, it is crisp. Any signs of kind of fluidity with the borders is a negative sign. So C is going to be color. We want to make sure that we have the right color to it. We want to make sure that the color is nicely uniform. It is not changing color, has different shades to it, and is throughout the same color. D is going to stand for diameter. We want to make sure that the lesions aren't too big or the freckles aren't too big. Something under 1/4 of an inch, especially, or in metric. We like that in medicine. We like something to be under 6 millimeters in width from side to side on the area. The last letter is going to stand for E, and that's going to be for evolution. We want to make sure that the spots that we're looking at stay the same, that they're not changing, that we're not losing any of those other letters before it. Like the borders aren't changing, the color's not, there's no raising of the lesion. These are all going to be some signs that it's time to call your primary care doctor or visit your dermatologist to make sure that the skin lesion or the spot you're looking at is not something cancerous and doesn't need to be looked at further. Otherwise, apply your sunscreen, get out in the sun, have fun, limit some of your sun exposure, wear some nice garments that help cover your skin up and protect it.